So, hi everyone. I hope all of you are doing very well. And we know now it's high time to start our revision in full-fledged manner. You have to pace up, you have to work hard so that you will get your dream seat. So, revision is one of the important key points that help you to achieve the seat of your choice. Why revision is important? See, anyone can read our textbook once, okay? So, even a non-medico can go through the workbook once. So going through a workbook once doesn't ensure you anything. So what you have to do is you have to read those books, not read, you have to revise those books multiple times so that you will be confident, you will be strong in each and every nook and corner of the book, and you will be able to tackle questions from these hard topics. Then only you will be able to get a seat of your choice. So, if you see the interviews of toppers who have aced very good ranks in recent exams, they will be keep on saying that they have revised subjects 4 or 5 or 6 times. So, how these people are able to do revision multiple times? All of you will be having equal amount of time, but those who are able to manage time better will get better results. Okay, so fastly or quickly going through these books again and again and again will give you a better memory. And here I will tell you how to quickly revise the radiology. And we have made a structural planner. Okay. So if you see the planner, you can see our first reading, not that the first reading should be completed in 380 minutes. I know most of you might have completed the first reading. Most of you will be into the second reading or the quick reading. Okay. So I know that. So first reading is 380 minutes. Now coming to the second reading, it has to be completed in 270 minutes, and the quick revision part should be completed in 150 minutes. That is around 2.5 hours. See, so if you are reading for the third time, if you are going through the workbook of radiology for the third time, you should be able to complete the workbook in 2.5 hours. That is the key concept. So we will be having, I will be showing you a quick revision, or I will be showing you a quick recap how you can do that. So I will show you the example of our first chapter, Introduction of Radiology. So if you see, we all know from this introduction chapter, there has been 2 or 3 or 4 questions has been asked. So how we started the session. So before you open the book, you should give 1 minute to just memorize or recollect what all are the important things that you have to remember from this. So you know from introduction you will be having you how to know the basic physics of CT, MRI, ultrasound, like that. Then from some topics about radiation protection, doses of radiation, and our side effects of radiation. So these are the 4 or 5 things that you have to study from introduction of radiology. So if you take that, if you get the points without looking into the book, then it will be more easy for you to read and remember. Okay, so if you could, when you start your second reading or your third reading, what you have to do is you have to quickly go through this, and you know that there are 2 types of radiation: ionizing, non-ionizing. MRI and ultrasound uses non-ionizing radiation. X-rays are usually from extranuclear origin, because they are from the electrons, outermost shell. Gamma rays are from the nucleus. All these things, you know, they are not that important, and you know what is important. X-ray tube is very important. There is an anode which is rotating, cathode. Both are made up of tungsten. There are 2 types of radiation: Bromstalling radiation, characteristic radiation. These are the questions. And coming to mammogram, another important thing, usually the anode is made up of molybdenum, and this mammogram uses characteristic radiation. CT and MRI not that important. CT is very quick, MRI takes time, but it will give you better resolution of images. And units of radiation, again only 2 things you have to remember: absorbed dose. If they ask you about absorbed dose, its units will be having A in that. Rad and Gray, both of them will be having A in that. Similarly, equivalent dose or effective dose, both will be having E in that. So just quickly see the pages, okay. And then the radiation protection devices: lead-apron and TLD badge. Lead-apron is made up of lead. At least 0.25 milli equivalents of lead should be there. And TLD badge is made up of a substance called as calcium sulfate doped with dysprosium. So these are the two things. Okay, then radiation syndromes. If it is up to 2 gray, you will be having hematopoietic syndrome. 6 to 10 grays, you will be having GA syndromes. More than 20 grays, you will be having CNS syndromes. Then another important thing is between stochastic and deterministic effect. Stochastic effect is dose independent. You know, it is all on phenomenon. Cancers, mutation, stochastic. All dose dependent effects are called as deterministic effect or non-stochastic effect. So like that, you have to quickly go. And in this table also, I have told you public exposure 1 millisievert, pregnant female 2 millisieverts. These are the few points that you have to remember. See, so hardly it will take around 3 to 4 minutes if you know what to read, if you know how to revise, if you know what is the previous year topics. Okay, and furthermore, from this thumb rule session also, you know, radiograph can be used for lung imaging as well as for any bone pathology. Radiograph will be the first investigation of choice, and you should know where is the ideal position of central venous catheter, NG tube, pacemaker, and DT tube. So you know, these are very simple things. And CT will be used for bleed, calcification, calculi, and any advanced lung imaging or osteodyostoma like that. And ultrasound and Doppler, you know, Doppler is for peripheral evaluation. Arterial Doppler can be done, venous Doppler for DVT, arterial Doppler for peripheral vascular disease. Usually there will be a triphasic flow. In DVT, there will be no flow. The vessels will become non-compressible. And in MRI, we have just briefly discussed the sequences like T1, which is for anatomy, T2 is for pathology, FLAIR is for periventricular lesions, SWA for these blooming artifacts in microbleeds or diffuse axonal injury, DWR diffusion for infarct imaging. See, so in a span of 5 minutes, I simply told the important points which has been repeatedly asked from the introduction topic of radiology. You may get 2 or 3 questions. So the take home point is you have to be confident in each page is from our workbook, okay, because the competition is very hard now. You don't stand a chance if you are going to leave one subject apart, and merely reading each workbook one time will never be enough to secure a good rank. So you have to be confident that you have to read these books again and again and again, and when you revise, you have to do it very fastly like this. You have to simply see the page, you have to tell what all points are important, you have to tell yourself which are important, which are not important, like that. So you for from my personal experience, I'm telling you that if you want to get a good seat, at least you have to go through each chapters at least 4 or 5 times, like that, very quickly, very briefly. So first time and second time it may be little difficult, you may take some time, but believe me, if you constantly do this, definitely you will be able to finish it very fast like this. Okay, and this time period for a very bright student, it will take less than 10 minutes for the first chapter. For average people, it can take up 20 minutes or 15 minutes as I have given. But see, believe me, all of you will be able to do this if you try hard. Okay, that is the power of active recall or active revision. You have to stimulate your amygdala, hippocampus very well. Try to recall things actively, not passively. So rereading and revision are very different. Don't keep on rereading, start revising, start revising actively. That is my sincere advice for you, all of you guys. So remember, revision is the key to success. Try to do 4 or 5 times revise. Keep planning like that. Even if you are able to do 3 times, that's okay, that is very good. But the thing is, you have to aim for better things. Okay, every one of you should be able to achieve a seat of your choice. So revision is the key to that. So keep sticking to this planner. Okay, we have given, see, I have given 20 minutes for the first reading, 15 minutes for second reading, and 8 minutes for the third reading. But if you are confident, you can finish that in 5 minutes or 4 minutes, just simply telling the points and going. So this is the key, and all the topper people will be able to do this. Every one of you should be targeting to achieve this level. Okay, that is my sincere advice for you guys. So please keep sticking on to these planners. And my another advice is, before you attend the VSV sessions, what you have to make sure is at least quickly go through all the pages of your workbook before you attend this VSV. Okay, that is another piece of advice. So believe in yourself, work hard, definitely you will get a seat. That is our guarantee. So believe in yourself. Thank you so much.